Many questions surrounding the outbreak and the impact. We want to put them to a medical expert for you right here. Dr. Vin Gupta is an affiliate associate professor at the University of Washington and an expert in pulmonary medicine. Dr. Gupta, we appreciate you being with us today here again. Today, a ninth person in our area died from coronavirus. How concerned should we be that the death toll is rising now?
I think we should expect it. This is what I expected. This is what I know. My colleagues in public health, epidemiologists all the way down to pulmonologists, folks on the front line, they expected this to happen because, frankly, now we're looking for the problem. Before we weren't looking for it, or we weren't looking for it in the right ways. Now we're looking for it in the right ways. We're basically testing anybody who presents with pneumonia-like symptoms. So if you're looking for something, you're going to find more of it. And so I suspect not only are we going to see the prevalence load increase, we're going to see people whose cause of death is secondary to coronavirus increase as well.
We spoke with family members of patients at Life Care Center of Kirkland who call, they can't get through to the managers there, they aren't getting answers from the CDC. How concerned are you with the response to this crisis? And I know there's a lot of folks involved and a lot of them are trying to do the best job that they can.
I think it's tough. I can say as a provider myself that you want to be as transparent as possible. And as somebody who has a lot of loved ones in their life, who's seen loved ones in hospital settings, you want to be in a situation where you get all the information. So I understand the tug of tensions on both sides. Providers want to make sure that they're giving accurate information in a space where everybody, the world's eyes on Seattle, on Kirkland specifically. So we want to make sure we're giving accurate information. What's the cause of death? What's happening? And if you're not precise, and it takes time, you want to be guarded with that information. So I understand the CDC's reluctance and reticence to be careful. And I think that's all they're trying to do. They're trying to be careful. I also understand if you're a family member, you want to know what's going on.
Yeah. Your specialty is pulmonology here, and that this condition here, coronavirus, affects how people breathe. And given the symptoms of coronavirus, at what point, because these symptoms mimic, colds and flu and that kind of thing, at what point should we get tested or self-quarantine or even call the doctor?
It differs. This is such a difficult question because it differs by the patient. And so what I would say is a fever, a cough, are in this moment, in our environment, are concerning, potentially concerning for coronavirus. And that's just how we're operating now. Any pneumonia-like symptom is concerning potentially for coronavirus. And so I would say present yourself, call your urgent care facility or your primary care provider if you have any symptoms, cough, shortness of breath, if you have pneumonia, let somebody know. Let somebody in your care team know that, so then they can do the appropriate triage to say, okay, maybe we should send a self-test kit to the home. Maybe you should come in to get an evaluation if we need to get vital signs. But that would be the trigger. Oversharing in this particular moment is not a bad thing.
That's okay. All right, let's bring in a couple of questions from our Facebook page here. Carrie Woods asks, if one person gets it in your family, can that one person be in quarantine in one of your rooms in your house? Like, say, you stock the room with food and water, they say, and have a bathroom to use.
Carrie, my response to that is that's a question I get a lot. That's a question I wrestle with myself. I would say don't overthink it. You're not going to be able to effectively quarantine within a home, much less. I think we advise people to stay home and do their best if they're in an apartment, to stay in their apartment if they have concerning symptoms. My advice is don't overthink it. It's virtually impossible to prevent the spread of infection within an enclosed space. So one door is not going to make a difference. Live your life. I think we're overthinking this whole epidemic here. This is, frankly, not as severe as the flu, so we need to keep that in mind.
All right. Laura McCorkle wants to ask about travel. How does travel affect our risk, and how does it affect the risk we bring to other places? Today, we learned a man in North Carolina who visited that facility in Kirkland has been diagnosed with coronavirus. Also, Seattle-Tacoma International Airport, they're increasing cleaning right now in the terminals, that kind of thing, shuttle buses, adding a lot more hand sanitizers. Let's talk about travel and concerns there.
I think, Laura, travel is going to increase your risk for infection, communicable disease infection, all times of the year, January to December, whether it's coronavirus, whether it's the common cold or flu. So I would say in this particular case, given what we know about coronavirus, I wouldn't worry about it. It's going to increase your risk of acquisition. But what we know about coronavirus is, well, the evidence tells us Yes, it can cause severe illness if you're elderly, if you have a pre-existing condition. But if you're younger, otherwise healthy, you're going to get over it. It's not going to be that big of a deal. So I would caution calm. I would say, let's focus on what we know. And what we know is, well, this is a contained illness. We think the mortality rate is actually quite low. So go ahead and travel. Live your life. Live your life.
All right. Dr. Vin Gupta, thanks for being with us today. Really appreciate all the information and your expertise.